more on this, Dr. Annelies Wilder-Smith, a visiting professor at Singapore's Nanyang Technological University, joins us live from Geneva. Professor, thank you so much for joining us. Now, we know the WHO is deliberating this matter. They could soon declare that the pandemic is over. What is the significance of this emergency status? How much of a difference would it make if the emergency status is lifted?
So they're still deliberating. We do not know the final decision. They may actually decide to continue with the declaration. And there's some advantages of continuing it. You keep the political will, you enhance, you keep the international coordination. And it also enables mechanisms like the use of emergency use listing, emergency use authorizations for vaccines, etc. But there will also be many who will argue that now we are at a stage of the pandemic where we can lift it because the cases are coming down. We see very few deaths now, and we have a very high population level immunity. So I'm very keen to hear what the final outcome will be.
Well, Professor, life has returned to normal pretty much all around the world. Restrictions have been dropped. International travel has resumed. Many countries have even stopped testing for the virus. But the WHO has been divided on whether the threat of COVID-19 is really over. Why is this so? What are their concerns?
If you lift the declaration too early, you lose on some mechanisms that help continue the coordination, keep the political will to ensure that we continue keeping the surveillance, keeping our vigilance, but also keeping booster doses high. On the other hand, I think we are soon at a stage where COVID should not be a unique disease anymore. It can now be integrated in the general infrastructure and should be treated like other diseases, such as influenza. The problem with COVID, obviously, we're still learning about this virus. It has always surprised us. It could surprise us again, and so we need to remain vigilant, basically.
Professor, you talk about this vigilance and the risk of lifting the emergency too early, but pandemic fatigue has set in across parts of the world. We can't go back to the restrictions of the last few years. We've been through this for more than 3 years now. And given that, we have some experience in handling the virus, most populations are fully vaccinated, is it time to start living with COVID and just moving on with our lives?
Totally agree with you. We have now been living with COVID for a long time, and we are continuing with our lives. Our lives are almost back to normal. So I cannot predict, what the outcome will be. But the vigilance means also we need to keep up our systems that we have established during COVID to make sure that we detect a new variant very early, that we have mechanisms in place to rapidly re-accelerate our responses and to update our vaccines. And so there are a lot of unknowns still within COVID, but I think we can all celebrate our overall victory over this crisis.
Well, with the recent surge, many new variants continue to appear in parts of the world. Should we still be worried about this? And will these variants or mutations continue to weaken, in your opinion?
So indeed, the virus mutates continuously. Every day there is a little, a change. But we have also seen that over the past more than a year, it has remained relatively stable within the Omicron sublineage. And within the Omicron, we know that it is associated with less severe disease. So WHO has 3 scenarios. The worst case is that we have a new variant that is causing severe disease again, or is really escaping our vaccine effectiveness. The best case scenario is that the virus weakens further and that we do not need further periodic boosting. The base case, and we're all working now with the base case is we will remain within the Omicron lineages and sublineages and further variants, but it will not get worse. But we will still need to periodically boost vulnerable populations, as we're doing now. The recommendation of WHO is still to provide boosters to those who are older and have other risk factors that put them at higher risk of severe disease.
Thank you, Professor. We'll all be eagerly waiting to hear on the WHO's decision. We were just speaking to Dr. Annelies Wilder-Smith, visiting professor from the Lee Kong Chian School of Medicine at Singapore's Nanyang Technological University.